Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about how to tab your CPT 2021 AMA Professional Edition book. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. All right, I will start off by saying this. I get this question a lot. Blue, how do you tab your books? What are your suggestions about tabbing books? Here's the thing, guys. I personally do not recommend tabbing your books at all. If you are about to go for your certification exam, even then still, I don't recommend tabbing your books. Here's the deal behind why. When I was coming up and I took my certification exam over a decade ago, they were very strict at the time. They said that there was to be no tabs at all in the books. They have since changed, and because these tabs come with a book, for this AMA edition, this is acceptable to use in tabbing your books if you are taking a AHIMA credential exam. I know that with AAPC, it's a little bit different, and they have different rules about tabbing, and they like their tabbing on the AAPC side. But I will say this, I did have a viewer try to come for me in the comments and demanded to know why and when did this change about the tabbing in the books. Because he said that he took his degrees designation a few years ago and they didn't have this. Guys, I am getting this off of the candidate guidebook directly from the ahima.org website. Now, I will never give you guys false information. I'm always going to bring you information that I have personally researched. That's what I do. I am a researcher by nature and by trade. That is what I do. So what I'm going to do is I'm going to leave the link for the candidate guide that I got this information from in the description box below. So that way you guys can look at it yourself. Please check out the description box at the bottom, right? Because every time the show ends, there's usually a question that can be answered by looking in the description box. So guys, please look at it. I take the time to put that information in there for you guys. So please do me the favor, if you have a question, check the description box first. But I'm going to go ahead and read this section right here so that way you guys know what I'm talking about when I say that how AHIMA feels about these tabs. So it says test center restrictions. To ensure the examination results for all candidates are earned under comparable conditions, it is necessary to maintain standard testing in a standard testing environment. Candidates must adhere to the following. No reference or study materials may be brought into the examination room. Code books with handwritten notations or comments are allowed, but must be free of any notes containing coding rules and guidelines from other reference materials, for example, Coding Clinic, CPT Assistant, and similar materials. Code books with post-it notes and other loose materials will not be allowed. No handmade tabs will be allowed. It is literally directly in the book, in the guidebook, and that is on page 15 of 42. So again, I will leave that in the description box below so that way you guys can check it out for yourselves. If you're still curious, call the AHIMA customer service so that way they can help you with anything further. So without further ado, I'm going to show you how I tab these. Tab this book because it does have the post-its, I mean not the post-its, but the the stickers in it. I will say this, tabbing your books is not going to make you go faster. Because a lot of people say, well, I use it to help me go faster. No, the way that you're going to be able to help yourself go faster is by actually doing the heavy lifting, going through the exercises, going through the workbooks, using websites like justcoding.com. Justcoding.com is a wonderful resource for medical coders. This is not an ad for Just Coding, but I am a huge fan. They have a free subscription side and they have a paid subscription side for their website. And on their website, they do have access to free coding quizzes. This is for diagnosis coding, procedure coding, and for inpatient procedure coding, the ICD-10 PCS procedure coding as well. So guys, check it out because that's another good way to kind of keep yourself going when it comes to practicing looking up the codes. And again, you're going to get faster with the book the more you use it. And the more you use it, the more those tabs are going to get in your way. Trust me. I've been there, I've done that, got a t-shirt. All right, so all right, so I'm going to show you guys how I do this. If you choose to do it a different way, that is entirely up to you. This is just what I do. You're free to do whatever it is that you want to do. So I'm going to take the first tab, which is the E&M tab, and I am going to flip to the E&M section, where the E&M section starts, which is here. And we all know, as we all know, January 1, the rules for E&M changed. So this is all new, all right? And I'm going to start putting the tab right here. What I do is I use these little white markers right here as my guide on how to put the tabs in the book, okay? So we are going to flip and keep going. And I'm going to do this whole thing with you guys, and I'm going to talk you through it. Because that's what I do, and you know I don't do editing, so so here's the anesthesia section, and we're going to take this tab and we're going to put it right here. So this is what is going to start a very cool cascade for these tabs. All right, so and the thing I like about the AMA edition is that it has these nice little colorful tabs on there, colorful sections actually, because each section is broken down in a different color. So that's what I like. It helps, and again, that it's set up that you don't need the tabs, but again, some folks like to have the tabs, they need them, and there you go. So we're going to go with the surgery right here, and we're going to put this tab right there. Okay. And then we're going to flip to the integumentary system. And there we go. Get this tab here and tap it right there. All right, integumentary. And then we're going to go musculoskeletal, my favorite, my personal favorite. And you know, guys, the more you look in these, look at these drawings, right? It's got like all the breakdown of the muscles and everything and the tendons and stuff. So make sure you guys take the time to look through these. I usually like to put the tabs where the codes start at. So I'm going to take this musculoskeletal tab right here and put it right here. There we go. Okay. And then we're going to take respiratory. See, respiratory and musculoskeletal, the sections kind of look the same, very similar with the color. So, but that's okay because we got the tab for it right here. There we go. And some people like to put it at the beginning of the chapter. I like to put it where the codes start because that's more efficient for me. Cardiovascular, a very good diagram of the heart. The veins, the arteries. Guys, you got to check this stuff out because a lot of times people get hung up on anatomy, and the book is designed to help you in that, and it's already got it in here. So I want you guys to think about those things when you're really struggling. The book already has the answers. You just have to get so familiar with it that you'll be able to start to know where to look to get those answers, right? And books are your friend. I've heard from many people lately, Blue, do we always have to lug around those big old books? Yes, get used to it because books are going to be your friend. And then here we go for digestive, starting back up here. And yes, you got to get used to these books. Don't hate the books. Yes, the encoder is much more easier, but you know what? You're not going to be able to use that encoder. We're on the urinary. You're not going to be able to use that encoder when you go to take your test. And if you want to go take another certification exam, you're still going to have to use the books. So always, never, ever, ever lose your speed. Okay. And this is broken down into male and female. So I'm going to do that. Come on. So just see how we did that there. There we go. And you're going to find that I'm going to have some tabs left over, and I'm going to explain why in just a little bit. Yeah, that's where it starts. So there's urinary, and then there's male and female. And then we're on to the nervous system. Nervous system. Chapter starts. More nice, beautiful, colorful illustrations, guys. Take advantage of looking at those. And then we go nervous right here. Ta-da! See, this was the only one that had to rip out a little part of the page. It's all right. And then eye and adnexa. Okay, eye, ocular, adnexa. So ocular and auditory are going to go together. That's the benefit of having to do 2 takes. So, and then we're going to hit radiology. See, that's all together on that one. So we're going to radiology. You've got all of that there, see? And then, here we go. It starts right here. Radiology. There we go. And then we've got Path and Lab, which is a huge section. It starts right there. There we go. Then we have, see how big that is? All right. Then we have the medicine section. Now, I'm going to explain this here in just a second. So the medicine section covers a lot. Not going to lie. I'll put it up here. It covers a lot. It covers all kinds of procedures. It has the vaccinations. It's got psych. It's got dialysis. It's got ophthalmology, pulmonology, neuro, and behavioral health, right? All in the medicine section. There's no little white tabby marker things to guide. But it's all here, right? And it's going to tell you right here on each tab. And for some people, they want this, and sometimes they will put these tabs up here at the top. But to me, again, it's a personal preference. If that's what you want to do, totally, that is fine. I'm not going to do the markers for that because, again, it's just too much. And but if you are working like in a clinic that does a lot of dialysis and you want to go ahead and mark that section, that is totally fine. You can use the white guide marker, or you can go just a little bit beneath it. That would be fine too. All right, so I'm going to go ahead and skip all of that, and then we're going to go to these category 2 codes. And for the rest of the week, I'm going to be doing some more demonstrations because I think, I haven't really done a whole lot of hands-on demonstrations with you guys because it was a lighting issue. But now, as we can see, this lighting issue has gotten better. So I will be doing that for the rest of the week. So these are category 2. And I'm going to put this tab right here. So for the rest of the week, I'm going to stick with this theme of showing you guys more of a breakdown on these books. Because I know sometimes, like when you're in a program and then like it may be a fast program and maybe you don't get a whole lot of hands-on training, and then it's like nobody ever showed me how to use the book. They just said, here, use it. So I'm just going to do that for you guys. All right. So category 3. So if you stick with me, 7:30 p.m. Central Standard Time, you'll be seeing more of these videos for the rest of the week. And then we're going to go back to regular scheduling with the Q&A Tuesday. And well, I did Q&A Tuesday this week. And I will do it next week. So, but like Letters to Blue is going to be for next week. So, so we can stay with the theme. Appendixes, which is part of the other show that I'm going to do. So I'm not going to go into it too much. But I'm telling you guys, this is possibly, the appendixes are possibly the most underrated resource that you can ever come across. Guys, take advantage of the appendixes. Don't neglect appendixes because the appendixes have so much information. They are incredibly helpful. And like I said, I am going to go through this on another video. But in the meantime, Appendix A through B has its own tab. But look at this. This is all about modifiers. And I know that sometimes people get hung up on modifiers because modifiers can get confusing. But this has like all the breakdown, like what it is. 23 is unusual anesthesia. 24 is unrelated evaluation and management service by the same physician or other qualified healthcare professional during the postoperative period. So it tells you everything and it explains what it is. So it's a very, very good resource. Appendix B is all about your additions, deletions, and revisions. Okay, so a very, very good resource back here. And it's going to tell you like all the things that were updated. Appendix C, the clinical examples. So Appendix C through F is going to go right here. And I really like the clinical examples because it breaks down the E&M and it gives you like a pretty much like what an example would be like of a 99221 or whatever the level is. So this is another thing that can kind of help you if you're struggling with E&M. E&M is not scary, guys. I know a lot of people say E&M is scary. E&M is not scary. You just have to get into it, you know. And then once you get into it, it's really not bad at all. I mean, especially now with the new updates. The new updates have made it so much easier. But you still have to work for it. You still have to work to understand it. So G through J is going to be right here. So I'm going to put this little tabby thing right here. And then we have, what is the next one? K through P. Okay, so there's K, appendix K right there. Product pending FDA approval. And I'm going to put it right here because the other side is where it started at, but I'm going to put it right here. Okay. And then, is that it? Yes. And then we're going to put this index tab on there. So where the index starts. Here we go. So the index starts right here where you can start all your looking up of the codes. So I'm going to put it right here since I'm going to keep with that theme. But then watch this. Watch what happens. Are you ready? Are you ready? Ta-da! See how it cascaded just by using those little white tabby things right there as your marker. Okay, so that's just what I suggest. Again, you can do it however you like, whatever is much easier for you. Again, these tabs came with this book, so it is acceptable to use it that way. But like I said, to me, if you're taking the time to go through the exercises and use the book, it is going to be easier for you if you are working with a clean book. And I really recommend, guys, don't write in your books because the books already have the answers. And when you're in a stressful situation like taking your exam, right? And you're already like trying to like be in a crunch and hurry up and look through your book. You don't need all the distractions of all of your notes that has nothing to do with your exam. All right. It has everything to do with the fact that can you get through this in a timely manner? Recall the things that you've learned. Recall all the things that you know about looking up these different coding conventions and things like that. So it's very important that you trust your teaching and trust your instincts. When you are taking your exam, this is just a little, I know it's off topic, but when you're taking your exam, trust your first instinct because you know that's what happens to us, right? We think too much, we start overthinking, and then all of a sudden it's just like we're wasting time and time starts ticking away and I overthought, and then people end up kicking themselves because they were overthinking. Don't overthink, guys. Go with your first instinct because you know your first instinct is always right. And you're not expected to get 100% on your exam. Would we all love that? Of course, especially if you are working really, really hard, which everybody does work really hard to pass their certification exam. But when you're going through that exam, don't put so much pressure on yourself that you end up losing the whole thing because you absolutely wanted a perfect score. Are you going to pass your certification exam? Sure. But it may not be at a score that you like, but it doesn't make you any less of a coder. I want y'all to know that because you can start off with very bad teaching. You can start off with little to no instruction, I should say. And then as you get in the field, it's up to you and how you want to continue on. And if you're going to really push yourself to learn more, if you're going to get outside that box and say, yeah, I'm going to try something easy, not easier, but something out of the easy zone, something very difficult. I'm going to challenge myself. The more you challenge yourself, the easier it will get. But you won't know until you start getting out of your comfort zone and you really start to stretch yourself as a medical coder, because there's so much to learn out there. And like I said, I've been in this for over a decade, and I get excited every day to see what am I going to learn now and what can I share with you guys now. So, but when you really love what you do, you're not working anymore. And I don't feel like that. I don't feel like I'm working anymore. You know, when I do work on these shows, or, you know, when I'm at work, it's not really work to me. You know, there's minor things that are work, like meetings, coder meetings, that I find to be work. But other than that, no. If I'm meeting with my providers, it's awesome. When I'm talking with you guys, it's even more awesome, because it's just what I do now, you know. So I'm going to go ahead and wrap this one up. But I hope you guys have enjoyed this demonstration, and I will be back for more demonstrations the rest of the week. And so if you haven't already, I hope you hit that subscribe button. Please like and share my channel so that it can help others, because that is the whole goal of my channel, is to help others. So I'm going to go ahead and wrap this one up. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider, or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.